Today is our lucky day. We have the opportunity to sit down with Kelly Guzman, founder of Yellow Brick Consulting. Now, Kelly's not known for sitting still for very long in one place, so we're very fortunate. And I'm looking forward to learning a little bit more about Kelly. So join me. So Kelly, so nice to be sitting here with you today in a calm and quiet environment, at least for now, and just talk to you a little bit about yourself and Yellow Brick. And I want to start with kind of like the beginning. You have over 16 years of healthcare, clinical, administrative experience. What is that transition? How does that look in terms of being an RN and then being where you are today?
Well, thanks. It's great to be here. Thank you for having me. Well, I started my career as a pediatric nurse way back in the 80s, and at the time it was very similar to today where there was a nursing shortage, so got into being a charge nurse and administration very quickly, so have spent all of my career essentially in an administrative role. When I was at the Reagan Hospital at UCLA, I was the director for ambulatory and clinical services there. And while I was there, we were building the UCLA Ronald Reagan Medical Center and the Santa Monica Hospital, and was asked to be the director of transition there. And at the time, I loved my position because it was really like a internal clinical consultant, really focusing on quality projects, and I got to work with the emergency department, the ORs, all of the ambulatory suites. And then this was going to take me into the world of construction, which I had no idea about. So I jumped in and took that position and spent about 3 years there doing that, and realized that because of the Northridge earthquake, at least in California, required the seismic upgrades. So that's really how I started my career as a consultant in transition and activation.
So a lot of construction in the healthcare world means building new spaces, needing to understand how they're going to be used, getting folks living in those spaces on a day-to-day basis to provide good patient care. I think the client can feel as though they're drinking through a fire hose. Most normal people want to do this once in their lifetime, and yet here you are making a career of it. Why?
Well, I did work in the emergency department, and that was really fun, and this kind of reminds me of that. No day's ever the same, no client is ever the same, so just knowing that each project you have a really good, happy start, everybody's excited, then you get to the middle where it's a little tedious, and there's cost cutting that happens, so some not so fun parts of the project. So being able to be a project manager and have multiple projects happening at the same time, but also know like, hey, there's projects that are doing really well. This one's in kind of that middle phase, and then, you know, the happiness of opening and seeing this. And I think just being able to support those people, knowing that they do have a full-time job, so we come in and try to help them get through the work that they need to do as quickly as possible.
There is a sense of calmness that Yellow Brick brings to these projects. And as a matter of fact, it's been described to me as the Kelly effect. How do you do that? How are you able to look at a project and come in and help people get through that sense of frenetic activity?
A very bad day on a transition project or a construction project, while it seems horrible or scary, you know, I just go back and ground myself to say, this is a bad day, but, you know, we'll get through it. And so for the most part, everything that we do, fortunately we've done before. We've been doing projects together. Some of the team members 20 years, some 15 years, so a long, long time. So we draw on that experience and say, hey, remember this project? We didn't think that was going to happen. We'll be fine. We also have the chance to step back and really, you know, we're not here every single day. We're not living in that space every day. So we do have that ability to step back, draw on that experience, and then put a plan together to say, like, we can get through this, we'll be fine, and move on.
That's great. Clear on Yellow Brick's website, you have your list of values, core values for the company, and I noticed that one of them is courage. And why is that?
Well, it took courage to leave a traditional role in nursing and even a job as a nursing director. One, to get into transition and activation, but then for all of the team to follow and to join the team. You don't go to school to become a transition planner, right? A project, there's information about project management, but nobody knows what we do. So just to take that step to dip your toe in and say, I'm going to do this, and then the first people who came to Yellow Brick, we didn't have clients, we didn't have a budget. So I was very lucky to have 3 people, and Kathy and Allie, who said we're going to jump on the bandwagon and help create the tools and go get clients. So they jumped on and helped us to get going. A lot of my family took courage to support me, and my mom's a respiratory therapist, and so she's one of our project specialists, and my niece is a clinical nurse specialist, so she jumped in, and Christina, who you know is a niece, but I think just, again, in everything else, trying new things, never being satisfied with the status quo, kind of pushing ahead, doing this video, making myself uncomfortable. I think it's something that at the time I'm not excited about it, but at the end, we did that. That's pretty cool.
What does the future look like for Yellow Brick?
Our team is, I would say, unique in the sense that we have a very lean team, so we don't have a lot of overhead. So our team wears multiple hats and does different things. So people have kind of stepped up and are taking on some of the things that I typically do, and really kind of stretching themselves. So we were looking at, how do we transition? We've hired some new folks on the team, so how do we integrate them into our team who's been together for 10 years, 9 years, 8 years. So really looking to spend a lot of time with our team to make that happen, to make them comfortable in their roles, and so I can step back and do other things. And then we've just hired a director for behavioral health. So during COVID, we realized how important that is, and we know that we've been on behavioral health projects, but didn't have an internal subject matter expert. So we have that internal SME now, and she's been very helpful in training us, helping us to think about the differences for a behavioral health department, unit, clinic versus an inpatient acute area. So we'll be working with her on those projects.
And you've published 2 books with very detailed information, a lot of resources. And while people obviously have to pay the price of the book, in essence, you're giving away the information. Clients can call you anytime and tap you for resources and direction to deal with a problem that they're having. What's your philosophy with that?
It's interesting because I know people on our team even were like, why would we give this away? And I think for a lot of places that we work, they don't have the luxury to have a consultant. They don't have the access because they're in very remote places. We've worked up in Nome, Alaska, and in Indian reservations and things like that. And we take care of people. We're taking care of patients. We're taking care of, babies at the end of the day. So having that information and sharing it, there's no way we would be able to help everybody who's doing this. So having that standard, having people know what to expect, I think, one, it helps us when we do go in and somebody's read our book to know what is transition planning. So for me personally, people have been very generous in the past, so I think it's just kind of paying it forward.
Well, is there anything else that you want people to know about you as we wrap it up today?
I think just taking chances and, kind of dreaming big. I've been very, very fortunate. I think, people ask, like, how do you do this? Or, and it was really, some of it's luck. Some of it was, being brave and just saying, okay, I'm going to go try it. But having other people such as you and other folks who I've leaned on in the past to say, what do you think about this? And having crazy ideas and, just networking and reaching out and kind of dreaming. So I think just, always push yourself and keep learning. So.
Well, thank you so much for sitting down with us today and allowing us to get to know you a little bit better. And we look forward to what the future holds for you and Yellow Brick.
Thank you very much.
Well, I enjoyed spending time with Kelly Guzman and getting to learn a little bit more about her and Yellow Brick Consulting, and I hope you did too.